Important message: digestive issues in seniors are not just uncomfortable. They're often warning signs of something deeper. Best probiotics for better digestion can mean the difference between struggling with every meal and enjoying life again. In the United States, millions of seniors suffer from gut problems, yet many don't realize that the right probiotic might completely change their quality of life. Constipation that lasts for days, bloating that makes it hard to button your pants, a constant feeling of fullness even when you've barely eaten anything. These are real, daily struggles for so many seniors in the United States, Canada, the United Kingdom, and Australia. And they're not just annoying. They take away your freedom. They make you avoid social events. They make simple pleasures like having a meal with your grandchildren something you start to dread. What most people don't realize is that our gut microbiome, the community of bacteria living inside our intestines, starts to change dramatically as we age. After the age of 60, many of the beneficial bacteria we rely on for digestion start to decline. And when that balance shifts, harmful bacteria begin to take over, leading to sluggish digestion, nutrient malabsorption, and a weak immune system. In the United States, where processed foods are everywhere and medications like antibiotics and NSAIDs are commonly used, seniors often have an even more disrupted gut flora. And unfortunately, the standard American diet doesn't help. Low fiber, high sugar, and not enough fermented foods, this combination destroys the diversity of good bacteria and opens the door for all sorts of problems like leaky gut, IBS, chronic constipation, and even inflammation-linked depression. It's important to understand that your gut health doesn't just control digestion, it impacts your brain, your joints, your skin, your immune response, and even your energy. When your gut microbiome is out of balance, you're more likely to get sick, feel tired, and have mood issues. That's why choosing the best probiotics for seniors isn't just about better digestion, it's about overall health and staying independent. One of the major issues with digestion in seniors is the decline in stomach acid. After age 60, most people produce less hydrochloric acid, which is critical for breaking down food and absorbing nutrients like B12, calcium, and magnesium. Without it, food starts to ferment in the gut, feeding the wrong bacteria and causing bloating and gas. Some seniors are misdiagnosed with acid reflux and given proton pump inhibitors or antacids, which further lower stomach acid and make the problem worse. It becomes a vicious cycle. That's where specific strains of probiotics come in. Certain strains like Lactobacillus plantarum, Bifidobacterium longum, and Lactobacillus acidophilus can support a more balanced microbiome, help improve nutrient absorption, and reduce inflammation in the gut lining. In one large clinical trial, conducted in Canada, seniors who supplemented with a probiotic that contained Bifidobacterium lactis reported significantly fewer digestive issues within just 8 weeks. Participants had less bloating, more regular bowel movements, and reduced abdominal discomfort. In the United Kingdom, a study on elderly patients living in care facilities showed that probiotic yogurt helped improve stool consistency and gut motility, reducing the need for laxatives by more than 40%. These results are not just numbers. They reflect real change in how people live. One 74-year-old woman from California said she had suffered with constipation for over 10 years, often going 5 or 6 days without a bowel movement. After just 3 weeks of using a high-quality multi-strain probiotic, she started having daily movements again and said, "I finally feel like I got my life back." But not all probiotics are created equal. Many over-the-counter brands in the United States are underdosed or contain the wrong strains entirely. Some don't survive the acid in your stomach, and never even reach the intestines where they're needed. Others are made with fillers, synthetic additives, or milk-based carriers that actually make symptoms worse in people with sensitivities. Seniors need strains that are clinically studied, properly dosed, and delivered in a way that survives stomach acid. Look for products that list CFUs, colony-forming units, in the billions, at least 10 to 50 billion CFUs per serving, and that include enteric-coated capsules or delayed-release technology. Another important point for seniors is whether the probiotic includes prebiotics. These are plant fibers that feed the good bacteria. Without prebiotics like inulin or FOS, fructooligosaccharides, probiotics won't thrive for long in the gut. It's like planting seeds in dry soil. You won't get much growth without the right nutrients. Many of the better senior-targeted formulas available in Canada and Australia include both probiotics and prebiotics for maximum effect. And here's the part that most people overlook. You have to stay consistent. Taking a probiotic once a week won't change your microbiome. It takes daily use over several weeks or even months to see real, lasting changes. In a survey from Florida, 63% of seniors said they had tried probiotics at some point, but only 22% said they noticed any improvement. When asked why, most admitted they didn't take them regularly or stopped after a few days. Others said they just grabbed the cheapest bottle at the drugstore without checking for the right strains. This is a huge issue. It's not that probiotics don't work, it's that the wrong ones are being used, or they're not being used correctly. Seniors also need to be cautious about interactions with medications. For example, people taking immunosuppressants or those with a history of pancreatitis should consult a healthcare provider before starting any probiotic. But for most older adults, the benefits far outweigh the risks, especially for improving digestion, bowel regularity, and nutrient absorption. In the United States, especially in states like Texas and Arizona, where climate and dietary habits often make dehydration and constipation worse in the elderly, a probiotic regimen combined with increased hydration and more fiber has helped countless seniors regain regular digestion. Doctors have noted that probiotic therapy can reduce reliance on laxatives, which often cause dependency or electrolyte imbalances when used long-term. That means fewer ER visits for bowel-related emergencies and fewer days spent in discomfort. Into Australia, healthcare workers in senior communities have seen major improvements in energy and mood when elderly residents start using probiotics. Why? Because the gut-brain connection is real. Up to 90% of serotonin, the feel-good neurotransmitter, is produced in the gut. When digestion is off, mental health often declines. Seniors who once felt sluggish, anxious, or irritable reported feeling calmer and more alert after just a few weeks on the right probiotic formula. One man in his early 80s shared that after being on antidepressants for 5 years, his doctor lowered his dose significantly after gut health improved, something he never thought would happen at his age. In the United States, the lack of proper education around probiotics for seniors is a massive failure of the healthcare system. Most seniors are prescribed medications like stool softeners, fiber supplements, or laxatives without ever being told that the root cause of their digestive struggles might be microbial imbalance. Hospitals and care centers in the United Kingdom and Canada are starting to incorporate gut health evaluations into geriatric care, but this is still the exception, not the rule. In Australia, a few progressive clinics have started recommending probiotic-rich nutrition plans to seniors as part of routine health maintenance, especially for those recovering from surgeries, hospital stays, or antibiotic treatments that wipe out gut flora. These are the models the United States should be following more aggressively. Yet the system remains reactionary instead of preventative. What many seniors and even some healthcare providers don't understand is that poor gut health doesn't always present with obvious symptoms like diarrhea or gas. In fact, for many older adults, the signs are subtle and often misattributed to just aging. These signs include poor appetite, brittle nails, dull skin, unexplained fatigue, and even mental fog. Studies from university hospitals in Canada have shown that these symptoms can often be traced back to dysbiosis, an imbalance between good and bad gut bacteria. That's why one of the most critical but overlooked signs of gut dysfunction is nutrient deficiency. When harmful bacteria dominate, they prevent your body from absorbing the vitamins and minerals from food, no matter how well you eat. A deficiency in vitamin B12, for example, is extremely common in seniors with gut issues, and it can lead to fatigue, neuropathy, and cognitive problems that are often mistaken for early dementia. Magnesium deficiency, another common problem, leads to muscle cramps, poor sleep, and irregular heartbeat. Probiotics like Bifidobacterium breve and Lactobacillus rhamnosus have been found to improve the absorption of these critical nutrients by strengthening the gut lining and reducing inflammation. Seniors in the United States who add probiotics to their daily routine often report that not only does their digestion improve, but so does their sleep, energy, and even joint pain. It's all connected because gut inflammation fuels systemic inflammation throughout the body. One common frustration in elderly communities in Texas, Florida, and even more temperate regions like California is the unpredictable bowel movements that make outings and travel feel stressful. Imagine feeling afraid to leave the house for fear of an accident, or having to carry extra clothes just in case. This isn't just inconvenient, it's humiliating. Seniors living with IBS symptoms or post-infection gut sensitivity often feel like prisoners in their own bodies. In many of these cases, the right probiotic strains, especially those known to regulate gut motility like Saccharomyces boulardii, can offer significant relief. This yeast-based probiotic helps eliminate diarrhea without constipating the user and has been shown to support a healthy intestinal barrier. It's especially effective in people recovering from Clostridium difficile infections, which disproportionately affect the elderly and are often caused by antibiotic use in hospitals. In a long-term care facility in Ontario, one nurse practitioner shared that her patients who took a blend of Lactobacillus casei and Bifidobacterium bifidum not only experienced better digestion, but also required fewer sick visits and had fewer complaints about fatigue. These strains are known to modulate immune responses and have shown potential in lowering inflammatory cytokines that can damage the gut lining. The residents also reported fewer colds and infections during flu season, which reinforces the connection between a strong gut and a strong immune system. In a time when United States seniors are bombarded with pharmaceutical ads and offered little nutritional guidance, probiotic therapy stands out as an affordable and effective option that's largely ignored. Even more concerning is how antibiotics are handled in elderly populations. Seniors in the United States are often prescribed antibiotics for minor infections like UTIs or bronchitis, sometimes without confirmation of bacterial cause. These drugs don't just kill harmful bacteria, they annihilate beneficial gut flora too. That's why it's absolutely essential that every senior taking an antibiotic also takes a high-potency, multi-strain probiotic, not at the same time of day, but spaced a few hours apart. Clinical data from hospitals in Australia and the United Kingdom has shown that seniors who do this experience fewer secondary infections, less antibiotic-associated diarrhea, and faster recovery times. Yet, how often are seniors told this? In most cases, never. Another major challenge that affects probiotic success in seniors is low fiber intake. A high-fiber diet is what keeps those good bacteria alive and active. Unfortunately, most seniors in the United States get less than half of the recommended daily fiber intake, largely because they eat processed, easy-to-prepare foods that are low in roughage. Foods like white bread, instant oatmeal, and packaged snacks don't feed your microbiome. They starve it. A probiotic supplement alone isn't enough if the bacteria don't have fuel. That's why doctors in Canada recommend combining probiotics with fiber-rich foods like chia seeds, ground flax, cooked lentils, and oats. When paired together, fiber and probiotics create a gut environment that promotes regularity and reduces toxic buildup in the colon. In some senior support groups in Arizona and New York, members report that adding probiotics helped eliminate the chronic bloating they'd had for years. For one man, it meant no longer needing to loosen his belt after every meal. For a retired teacher in her late 70s, it meant being able to go on long walks again without worrying about cramps and unpredictable gas. These are the real daily victories that restore dignity and comfort. The key is understanding that probiotics aren't an overnight solution. It takes time to shift a microbial ecosystem, especially one that's been unbalanced for decades. And it takes consistency, the right strains, and supportive diet changes. Unfortunately, insurance in the United States typically doesn't cover probiotics unless administered in a hospital setting, which deters many seniors on fixed incomes from trying them. This is deeply frustrating because a 30-day supply of a quality probiotic costs far less than even one emergency room visit for constipation, diarrhea, or gut inflammation. Some forward-thinking clinics in California have started giving out free samples of medical-grade probiotics to their elderly patients and have seen remarkable results, not just in digestion, but in mental clarity and mood as well. This shows that even small, low-cost interventions can make a profound impact when implemented correctly. Seniors who have struggled for years with unpredictable digestion, painful bloating, or chronic constipation are often amazed at what happens when the right probiotic takes hold. Some describe it as a fog lifting, not just in their belly, but in their head. The gut-brain axis is real. Mood, memory, focus, all of it is tied to what's happening in the gut. When that gut is inflamed or overrun with bad bacteria, the whole body suffers. But when it's healed and supported, the transformation can be dramatic. And this isn't just theory. In one large-scale trial from New South Wales, Australia, seniors who used a probiotic protocol alongside basic dietary changes reported up to a 70% improvement in gastrointestinal symptoms over 3 months. Many said it was the first time in years that they felt comfortable in their own bodies. In Florida, many assisted living communities have started to observe something unexpected among seniors who consistently use high-quality probiotics. A drop in overall medical complaints. Not just fewer bowel issues, but fewer aches, fewer mood swings, better sleep patterns, and less confusion. This has led some staff to privately call probiotics the silent miracle for the elderly. And they're not wrong. What's really happening is the reduction of systemic inflammation, a root cause of many age-related conditions including arthritis, diabetes, cardiovascular disease, and neurodegeneration. When the gut heals, everything else becomes easier to manage. That includes conditions like autoimmune disease and chronic fatigue syndrome, which have been shown to worsen when the gut barrier is compromised. One of the most overlooked benefits of targeted probiotics in seniors is their potential role in protecting cognitive function. Studies coming out of California and Massachusetts are beginning to link probiotic therapy with reduced markers of brain inflammation. It turns out that gut inflammation leads to the production of endotoxins and inflammatory cytokines that cross the blood-brain barrier, damaging neurons and accelerating decline. But when the gut microbiome is restored, levels of these harmful compounds drop, and mental function can actually improve. Seniors who once struggled to remember names or follow conversations are reporting clearer thinking and better memory recall within 8 to 12 weeks of starting a probiotic protocol. Strains like Lactobacillus, Helveticus, and Bifidobacterium longum have been shown to reduce cortisol levels, lower perceived stress, and even decrease symptoms of mild depression in elderly adults. These are real changes, measured not only in lab values, but in how people live their lives. One woman from Nevada, aged 81, described herself as being trapped in a fog for over a decade. Doctors had blamed it on aging, grief, and medications. But after 3 months on a probiotic specifically designed for cognitive support, she told her daughter she felt like herself again, mentally present and emotionally calm. It's a reminder that, for some, the brain doesn't need more drugs. It needs a healthier gut. Yet even with growing evidence and testimonies like this, access to proper probiotics in the United States is still inconsistent. Many seniors are sold inferior products that don't contain live cultures or are mislabeled entirely. A 2023 investigation found that over 50% of probiotics sold in U.S. drugstores had fewer viable strains than listed, with some having none at all. And seniors, often on fixed incomes, are wasting money on products that do nothing. This is unacceptable. Seniors need regulation, they need education, and they need support. In Canada and Australia, there are stricter labeling requirements and better transparency around CFU count, survivability, and strain research. These policies protect consumers. It's time the United States demanded the same. Digestive health in the elderly is not just a minor issue. It affects every part of their quality of life. It dictates how often they leave the house, what they eat, how they sleep, how they interact with family, and even how long they live. Chronic inflammation from gut dysfunction can shorten lifespan and reduce independence. That's why seniors in the United Kingdom who are part of probiotic studies are also being monitored for cardiovascular and metabolic markers. And the early results are showing positive trends. Lower cholesterol, lower blood pressure, and improved blood sugar regulation. The gut doesn't just process food. It communicates constantly with every system in the body. Even the musculoskeletal system responds. There is a link between gut dysbiosis and sarcopenia, the age-related loss of muscle mass. New research shows that harmful gut bacteria may impair protein synthesis and reduce amino acid availability, which makes it harder to build or maintain muscle. That means a senior could be eating plenty of protein but still losing strength, simply because their gut can't absorb or utilize it effectively. When seniors add the right probiotic, especially those that support protein metabolism, they often see better results from physical therapy, strength exercises, and even basic mobility routines. In Arizona and British Columbia, some physical rehab centers are beginning to recommend probiotics as part of the pre- and post-rehab nutrition plan, recognizing the gut's crucial role in physical recovery. There is also a social and emotional side that must be acknowledged. Digestive distress isolates people. Seniors stop attending family dinners, avoid restaurants, and turn down invitations. They worry about how long they'll be away from a bathroom or whether their gas or bloating will embarrass them in public. This kind of social withdrawal increases the risk of loneliness and depression, which are already major issues in the elderly population. Probiotics don't just fix the physical symptoms, they help remove the fear. They make it possible to say yes to more things again. One 76-year-old veteran from Texas said that after 2 decades of avoiding public events, he was able to attend his granddaughter's graduation and sit through the ceremony without discomfort for the first time in years. That's not just a digestive win. That's a life-changing experience. Healthcare professionals in the United States need to be more proactive about recommending these solutions. Geriatricians, nurse practitioners, and primary care doctors should be trained to ask about bowel habits and educate on microbiome health. Probiotic therapy should be as routine as blood pressure checks or cholesterol panels for seniors over 65. Especially for those with a history of antibiotic use, gastrointestinal surgery, poor diet, or chronic inflammatory conditions. Waiting until a senior is in crisis mode before discussing gut health is negligent. In Australia and the United Kingdom, public health campaigns are beginning to include gut education for older adults. They explain not just what probiotics are, but why specific strains matter and how to take them correctly. That level of clarity is still missing in the United States healthcare space. We also need to talk about food. A probiotic supplement is powerful, but it works best when paired with fermented foods like kefir, sauerkraut, miso, and plain yogurt. These foods provide live cultures that enhance gut flora naturally. Yet in many United States retirement homes, meals are based on ease of preparation, not nutritional value. Frozen dinners, soft breads, and sugary desserts dominate the menu. Imagine what would happen if every senior facility committed to serving one probiotic-rich food per day. The long-term effects on hospital admissions, medication needs, and patient satisfaction could be profound. In some progressive care homes in Melbourne, this experiment is already underway, and early reports are promising. There's no one-size-fits-all answer when it comes to the best probiotics for seniors. Each person has a unique microbiome, medical history, and lifestyle. But there are evidence-based guidelines that help most seniors get the best results. Multi-strain formulas, with at least 10 to 50 billion CFUs, encapsulated for delayed release, paired with prebiotic fibers and taken daily without skipping. Combine that with a whole foods diet rich in fiber and hydration, and the improvements can be nothing short of transformational. Seniors don't need to accept digestive distress as a normal part of aging. They don't need to live with pain, bloating, or embarrassment after every meal. The right probiotic, used consistently and correctly, can restore dignity, comfort, and joy, sometimes for the first time in decades.